They put you in a 5-star hotel, send you a limousine, but at the end of the day, what you're going there is kind of all my friends' experience have been bad. It is so impressive that what he can create naturally, natural hairline without the help of finasteride. I'm really happy with his work and his recommendation. I'm happy with the hairline. Definitely, I'm happy with the hair. Hi guys, my name is Supreet. I'm from Australia, Sydney, and back here at Satya Clinic with Dr. Shell after three and a half years of my first surgery with Dr. Shell. I got my hairline fixed by him 3 years ago, and you can see I have achieved the perfect result that I wanted. Natural looking hairline. No one has ever told me that I've had a hair transplant ever in my life. I'm back here three years ago to get some work done on or to fill up my crown area, and I cannot thank his team himself. Help me through any questions, any queries, any doubts, and suggest me the right procedure, right number of grafts, not overdoing it. Even 3 years ago, I've had the best support, post-op support from his team and himself for a good year, where he was guiding me through the shedding phase and every other possibility or every other doubts that I had. Now I'm back here 3 years ago. I'm going to go through another procedure with him, and I'm really happy the way him and his team has helped me. I would recommend Satya Clinic and Dr. Shell for any hair transplants or any other surgeries regarding the hair that anyone needs. They are a great team. Good job, guys. One more thing I would like to mention, guys, that what makes Dr. Shell's surgery and Satya Clinic's support extraordinary is that I have not taken any steroids or finasteride for the growth after the surgery. This is all natural. I've not used any medicine, any vitamins, or any minoxidil as well. I just take care of my hair as he recommends, and this is just all natural hair without any finasteride.
The last thing which we actually told was amazing, great. I mean, the turkey thing.
Yeah.
Actually, it's happening.
It is happening.
Yeah, it's happening.
Absolutely true. And I'm telling you, there has been an instance where one of my friends wanted to come, but he got recommended somewhere else. But he lives in Punjab, so it was difficult for him to stay, and he did it somewhere. And I told him that to come here.
Yeah, the hairline looks so unnatural, and most of the times what they do, they put the patient on finasteride, and everything fills up back there, and in between as well. And patients are under the impression for a year or so that things went good. And then afterwards, once they stop the medicine, things change.
When I went from here, after I got it done, I met a guy at the gym, my gym in Australia. And he obviously could tell that there was a transplant done, and he got it done from Turkey. And he told me that he is on finasteride and everything else, and he kept taking it for a good 6 months or a year. His head was fully grown, like a good hairline. But then he started having problems with some other situations at home and with his other personal life.
Sexual
problems. And then he stopped it because doctor told him to stop it, and that's fine. But then I could see that all his hair went down, like silly crazy. He just lost it, and he was more demotivated and discouraged than actually after the surgery, how happy it was. It can play a very big psychological effect on that as well.
And he was, for all those good 6 months when he took the medicine, he was under the impression that doctor did a wonderful job.
Yeah.
And as long as people keep taking the medicines, they are under this impression.
Yeah, definitely. I even recommended him to go to India, but to India and get it done with you, because he was happy with because my hair just went. I couldn't style it. You see the previous picture, there was no hair here.
Yeah.
Now I can style it. I mean, the other day when I came to you, it was a bit messy, but I did put a little, after your recommendation, I don't put too much hair product, but just a little bit of cream or gel or something, and I style it. So it's on a daily basis I do that. Otherwise, it wouldn't have been possible.
Another thing which is important, which I did and planned for you, was that we planned this hairline not too low. Okay. So when we know that the back thing or the merging, I don't have to do. Medicine can do it for me.
Yeah.
So I can afford to get the hairline low,
Lower.
which may look good for time being, but then I am investing my entire donor bank here lower, and then I don't have anything left for this area.
Yeah.
And second important thing is in Turkey and in India as well, a lot of places where which attract medical tourism, they are doing only one type of surgery, that is FUT.
Yeah.
And when you do only FUT, the problem is only FUE.
FUE.
And they will sell FUE by different names. Okay, they will call it direct implant, indirect implant, or whatever. They'll have all kind of funny names.
Yeah.
But yes, at the end of the day, what matters most is the result.
Yeah.
And when the result is it contributed to up to an extent of 80% through medication, you are kind of gone because you cannot trust.
No.
You cannot trust. And so many people come to me for repair all across the globe. Australia, India, US, Europe, they have got transplants done, took medicine for some time, and they were happy. Or the entire donor was invested here. Now they have a band kind of thing, which doesn't look that dense, which doesn't look aesthetically that good, and but still, I mean, people go for it because they generally fall for one shot glory.
Yeah.
So I would like to say here that it is one shot glory versus long term planning. So rather than getting it right once, I think it would be better if you plan it right and get it right for a longer period of time rather than exhausting all your resources in one go. And this is a message for people who have high grade baldness or progressive baldness or any kind of baldness. One, this is a journey which you have to plan. Don't fall for very low hairlines. Second, there is a limited donor which can be used thoughtfully and in a planned way. That means if you plan the journey, like there are two methods, FUT and FUT, and nothing is untouchable. Okay, both are good, both are reliable. There is no fight between two. Both are good methods, and they will help you in this journey. And you cannot carry forward this journey just saying that only FU will take you through it. Okay, only FU is not going to take you through. Okay, so at one point of time in progressive baldness, you'll be needing FUT. So all those people who have heard stories about FUT being, a bad surgery, old surgery, not the latest one, and all that is a bluff. Okay, because you have limited donor, you have to make full use of it. Second important message is medication are important, but not for everyone. So one shoe doesn't fit all. If I give you a blanket treatment to cover up my incapabilities, incompetence, then I'll put you straight away, whosoever comes to me. If he comes to me at the age of 37, I'll put him on finasteride. I'll put you on finasteride. If somebody else comes to me, suppose a guy of 60 years of age comes to me, I'll put him on finasteride. 20 years, whatever grade of baldness, whatever the progression has been in last few years, I'll just straight away put everyone on finasteride because finasteride is free cabal, free ka credit. Okay. I support, I'm not against the medicine, but what I'm telling is right dose, right timing. Okay. So even if we have to start the medicine, if it is possible to delay, then it's good because you develop kind of tolerance and dependence on it. So you cannot leave it once you start. And there are issues, like you told also, there are some issues which can happen and which happened to your Australian friend.
Yeah.
So be aware of these things. That's why I always say plan it right and think twice, be wise. So it's a very important decision of your life, and don't just get mesmerized by seeing results because all that glitters is not gold. Okay, so there are things which may look very good even in daylight, but they
Go
might
for something that you can sustain.
Yes.
Sustainability is the key.
yes
You don't need something for just to work for you for 1 or 2 years.
exactly.
I've come here after 3 years and I have no problems, and I know when I get my treatment done this time, I'll be happy for another 5, 6, 7 years. It's not going. So sustainability is the key
Yes.
with Dr. Shell. I think that's the recommendation which has worked for me.
And see, in this frame, you are seeing two hair transplant patients, myself as well.
Yeah.
I got a transplant done 2 years back,
Mm.
and I'm not on minoxidil, not on finasteride. My age is 46 now, and this hairline, what you are seeing here, the entire thing, like the merging, density, coverage, and the softer look of hairline. Everything does not have any free hair by the medicine called finasteride or DHT, any DHT blocker for that matter. And these are original hair, original result which sustains. In case I add finasteride to his results or my results, it will look amazing, like so amazing, so full, so beautiful. But I cannot put those softer hair which finasteride can grow. That is so important. You guys have to understand this. And second important thing, in this screen you are seeing one patient of FUT
Yeah.
and one of FUE.
Yeah.
So both the things are possible. And if you choose a surgeon who is competent and confident in both the techniques, you get the correct guidance, information, and I firmly believe that correct information is the key. And you need a surgeon or who can mentor your journey, because here is a journey and you don't know. And even as a surgeon, I don't know how your hair loss is going to progress. So I have to plan. I cannot deplete all the resources in one shot just for glory's sake. So be aware of those people who, just for the sake of glory, one shot glory, they put a lot at stake. And it is not them who are putting anything on stake. It is actually you who is putting a lot at stake, including your money, including your donor, which is very precious, including your health, which may get damaged because of the medications you are marrying to. And so that is why planning is important. So plan it right.
One thing I would like to add that after giving all the information, that Shell gives you the faith that is going to work, that this is going to work. Because then when you have the faith that it is going to work, it does work, because the positivity works in your favor to get the hair growing after the treatment.
Exactly. That's so important. That's very important. So thank you. Thank you so much. And best of luck.